Good morning. I've gone ahead and decided to cover a subject that I've been looking at with regards to the COVID-19. And it's been more or less due to the fact that I've seen several posts out there and whatnot while doing some research for the COVID-19 discussing the possibility of it being a bioweapon, etc. So obviously, saying that this is a bioweapon from China and released by China on the world would obviously have serious political consequences and could conceivably be considered an act of war. So I think it's necessary for the countries of the world to look at this virus in particular and assess whether or not it shows any potential manipulation that could indeed indicate it is a bioweapon. I'll discuss the economic impact of the release of this on the world later in general and the post-COVID-19 fallout that's likely to occur. But in any event, I would first like to cover a brief history of pandemics and where they have arisen from during the world, mostly in the last century. As we look at the major pandemic that wiped out a large proportion of the population in Europe, we look at the bubonic plague. That's not a virus, it's I think it was Yersinia pestis, brought in by rats, and those were brought in by silk ships apparently from China via Italy. And then they were slowly spread throughout Western Europe as a result of trade. The more recent pandemics that have occurred is the Spanish flu 1917-18 that actually went through in about 3 waves. The first wave was the least destructive, followed by the second and third waves, which were more destructive. And people still do not know exactly where that came from, but they know that it showed up in the end of World War I in France at the time, and that was obviously of significant concern to the militaries at the time because they were seeing 1 in 67 soldiers die from the disease. But the hypotheses of various locations for where it came from is somewhat difficult to pin down. There was the first case in the United States, which was in Kansas, which was right around the beginning of the cases in Europe. And people say, well, it came from Kansas. But the likelihood of that is probably pretty slim since we've never had some strange disease come out of Kansas. But recent documentation that's been uncovered shows that there were 94,000 Chinese workers that were imported by Canada from northern China during World War I to act as support in the rear lines of the war effort. And those 94,000 Chinese were brought to Vancouver, transported by rail to Halifax, and then transported from Halifax to the southern France. Now, those transports relate that there was an ongoing respiratory pneumonia illness going on in northern China at the time, and they actually had to quarantine some 3,000 Chinese due to respiratory illness of those that did arrive in Western Canada. So obviously there was a lot of exposure going on, so there's a hypothesis that the flu actually began from the importation of the Chinese workers, which would almost make a little bit of a sense given that world travel was not particularly prevalent at the time other than military travel, especially during the war. But the spread of the virus nearly corresponds in southern Europe with the arrival of that group of Chinese workers in France. We have pandemics called the Asian flu, which began in 1957-58 range, which again came from Asia, probably southern China. We have the flu of 1967, which again came from China. We have H1N1 and SARS, swine flu, coming from China. The only recent significant viral impact worldwide as a pandemic that has not come from China was MERS, which was a Middle Eastern virus. So then we have COVID-19. So obviously, for some strange reason, China seems to be a nidus for unusual pandemics running around the world and killing lots of people. As we look at the COVID-19 virus, it actually appears to originate in a bat that is not native to the Wuhan area. And the first and 14th patients documented with the COVID-19 virus had absolutely no connection with the wet animal market in Wuhan. So it raises the question as to whether or not the statement that this arose from the wet animal market is true or not. That being said, I don't know where it originally came from, but given that the first and the 14th patients in particular had absolutely no connection with the Wuhan market, I somewhat doubt that it potentially came from that market. Doing a comparison and contrast of virus conditions during the entire virus infection phase is interesting. We can look at the regular flu, where a person is exposed to the flu, and then they have an incubation period of roughly 3 to 5 days before they show up symptoms. At the time of symptoms from the flu, that's when they develop their peak viral shedding. It usually lasts from 3 to 5 days, depending on the person, occasionally slightly longer. Once you recover from the flu and are well on your way to recovery, you are no longer shedding virus. And then you essentially develop an immunity and cannot get infected with that particular strain of flu in general. As we look at the COVID-19, it's a much more unusual virus. I would like to first point out that there's a lot of talk on the news channels, etc., about asymptomatic patients and the spread of disease, and I have one interesting article with a lot of math about discussion that the presymptomatic people, which I'll explain that in a second, are the reason that the disease is spread so quickly. And without their inclusion, you do not get the statistics of spread that are currently in existence. A roughly 2,000 person study, again from China, described patients as asymptomatic. In other words, they tested positive for the disease but did not have any symptoms of the disease. But upon further questioning and following up of those patients, 95% of them did develop some symptoms. Many went on to have the formal symptomatology associated with COVID-19, and a fairly significant number also had less severe symptomatology, such as low-grade fever and not feeling well, instead of the full-blown cough, high-grade fever, etc. So nearly 95% of those, quote, asymptomatic patients were actually symptomatic patients upon further review of and follow-up of those patients. The problem is that as we look at COVID-19 and compare it with the flu, peak viral shedding for COVID-19 begins 3 to 5 days before you develop symptoms. And that viral shedding continues during your symptomatic phase and can continue for 7 to 14 days after your major symptoms have resolved. So that creates this huge window of infection period where you can infect others. And the disease is 3 to 4 times more infectious than the flu. So that explains why you can get a fairly significant rapid increase in the spread of the disease, because normally you think somebody is recovered of symptoms, they no longer are contagious, but in this particular instance, that is not necessarily true, and in most cases is not true. And then there have been some anecdotal studies of people who have recovered from the virus and then get reinfected. Now those are anecdotal, and I don't have any strong instance of this occurring in a significant number of people, and some of that could be due to the fact that certainly a lot of the Chinese testing early had 50% false negative results, so that makes it very difficult to go ahead and determine whether or not a patient truly did recover from the virus and was virus-free before they got, quote, reinfected, or did they just have a relapse. But all those factors together make this a very unusual virus. Whether or not it was manipulated in the lab, I don't know. That's for somebody else to figure out. But it certainly has a lot of unusual characteristics, and its history leaves something that needs to be investigated, and I hope that the world governments and health officials pressure China significantly in order to obtain an actual answer to this, because you'd certainly not want to go ahead and look at the implications of a biologic attack on the worldwide economies and worldwide peoples. That would be a horrific outcome, far worse than the actual viral attack itself. Anyway, have a good day.